session. Dr. Tanima Singhal and I welcome you all on today's Q&A session. You can put your questions in the chat box and I'll answer them. First, let me start the questions which are there in the Google form. So first question is from Sangeeta, low milk supply. So for low milk supply, always remember we have to understand why we end up into low milk supply. The low milk supply mostly happens when we are not following the things properly, like creating enough demand. If your baby is already taking formula milk, but you're not creating enough demand on your body, then how will the milk supply improve? The first is demand and supply. If your baby is already coming on the breast, but still you have to give formula milk, then to create extra demand, after feed the baby, just 10 minutes. Not at all coming on the breast, then obviously you have to create the demand by doing your pumps. Next of the things is you have to work on a few things like preparing your body and mind. So for that, what is important is water, hydration. Second is improving the flow by doing oil massage and warm compress, taking galactovox like lactomagic powder and Morico tablets. Next is keeping the baby skin to skin with you. And last thing is tracking. If you don't track your results, you will not be able to understand how is everything improving. So for tracking the results, always check the baby's formula intake and baby's weight gain. Next question is from Minakshi, low milk supply, already answered. Kajal, low milk supply at 7th month of the baby. So at 7th month, the baby is already having solids also. The improving milk supply, the protocols will be the same, but you have to work the same way as improving the milk supply. Hiral Patel, low milk supply, already answered. Smriti Verma, latching issues, big breast, small nipples. So don't worry about the big breast or small nipples. You have to hold the breast in a proper way. Specifically, when we talk about big breast and all that, then this cross cradle hold works very well, Smriti. So work on cross cradle hold and improve your latching issues. Misbah Sabreen, low milk supply, latching issues, already answered. Nandini, low milk supply. Tanu, when my baby feeds breast milk, he suckles for 2 to 3 minutes and falls asleep. So if the baby is not getting enough milk, then the baby will sleep. Either the baby's feeding technique, the latching technique, like holding only the nipple part and not the areola, then the baby will get very less milk and the baby will sleep. And the last thing is if the flow is not good. If the flow is not good, the baby will not get a good amount of milk and will sleep after 2-3 minutes. Next is Thilgavati. Breast milk is low. Already answered. Uma, breastfeeding for a long time, it is painful. Painful breastfeeding will always happen if the hard part of the baby's palate is on the nipple part. So in that way, you have to make the baby open a wide mouth and then latch the baby in a way so that the baby holds the areola and not the nipple part. Then it will not be painful. Uzma, low breast milk. Already answered. Amrita, baby is 4 months old. My milk supply is low and she's feeding through bottle but not latching to me. So first you have to work on your milk supply because if the milk supply is less, then the baby might not find more milk on the breast and will not be like comfortable latching and will not be like cooperative enough. So that way you have to work on your milk supply. Deepa, low milk supply, already answered. Preeti, zero breast milk. For zero breast milk, obviously you have to work on your milk. Latching difficulty, Debaswiti. Next is Shanti, low milk supply, already answered. Ruxana, how to store breast milk for long time after pumping? So if you have to store breast milk for long time, you can keep it in the refrigerator. So the storage guidelines are if you have to keep it on room temperature, you can keep it for 3 to 4 hours. If you have to keep it for a longer time, you can keep it for 3 to 4 days in refrigerator. More than that, you can keep for 3 to 4 months in your freezer. So these are the questions from the form. Now let me see the questions which are there in the chat box. First question is from Hiral, low milk supply and latching. Pumping करने से भी कुछ नहीं आता. तो अगर low milk supply आपको issues हैं तो पहले आप मुझे बताइए हिरल क्या आप पानी मसाज सिकाई बाकी लैक्टोमैजिक मोरिको और बाकी चीजें कर रहे हैं. खाली डिमांड सप्लाई से नहीं होगा, आपको बाकी चीजें भी करनी है. तो क्या बाकी चीजें आप कर रहे हैं अच्छे से? वो मुझे आप उस पे व्हाट्सएप ये इसमें लिखिए. मुझे बताइए आप क्या क्या कर रही हैं उसके साथ में. साक्षी, baby is 3 months old and around 6 kgs in weight. She's on breast milk completely, but she takes 30 minutes in one sitting. Sometimes she demands next feeding within 1.5 hours. Earlier, there was latch issues. Since 2nd January, she's directly feeding. Okay, so what is the question, Sakshi? Seema, how long can we take Morrico tablets? So Morrico tablets are 100% natural. You can take it as long as you want. Sakshi, one more question. I leak a lot. What could be the reason? Leaking is basically because of the oxytocin reflex, which is very normal. It's fine, Sakshi. No issues with that. हिरल अभी मंगवाया है, आया नहीं है, तो पहले हिरल बाकी चीजें भी स्टार्ट करिए। अभी इतना जल्दी परेशान मत होइए, क्योंकि आप डिमांड तो क्रिएट कर रहे हो, लेकिन अगर आप साथ में और चीजें नहीं करोगे तो फिर मिल्क सप्लाई उतने अच्छे से इम्प्रूव नहीं होगा जितना हमें चाहिए। तो पहले बाकी सब चीजें भी साथ में करना शुरू करिए हिरल। आप एक साथ सब चीजें शुरू करोगे तो आपको इम्प्रूवमेंट महसूस होगा। सीमा, is it safe to take Domstal for long time? Only under the recommendations of your lactation consultant doctor. So I don't see any new questions here. Sakshi, I didn't understand, like, I didn't know what your question is. You have written about it, which is fine, but I'm not understanding your
So,
question.
am I audible?
Yes, you're audible.
Yeah, so actually, I didn't, I was typing. So, my pediatrician mentioned that with this weight and at this age, she should be taking around 10 to 15 minutes, not more than that. And
Mhm.
plus, there should be gap of at least 2 hours between two feeds because she was having lot of gas issues. Um,
Okay.
so colic pain, colic episodes were quite regular for me. So
Okay.
I have stopped dairy completely. Means I do not take
Mm-hmm.
even curd or buttermilk also.
Mm-hmm.
So that I have done, but still the timing has means what 30 in fact sometimes 40 minutes also. She will not leave it, let it go. And
Okay.
within sometimes within 1 and 1.5 hours she would ask for the for another feed. So and
Okay.
regarding
So
milk
first
supply.
we'll 1 minute. Hmm. Okay. Mhm.
Regarding milk supply, earlier when I was exclusively pumping for 1.5 months or so, I was getting around 670 ml per day, 700 ml per day. Means milk supply was okay for her, and still I feel it is okay because doctor was saying the weight gain is fine. But I am not able to maintain any. I'm not able to create a schedule actually with her. That within 2 hours she is feeding. I'm not able to have a schedule with her.
Okay. So Sakshi, do you eat as per the schedule?
Eat
Like, do you
no.
eat exactly at the same time every day?
Means you try used to, but now I don't at all.
Correct. So we are human beings. So if you see your family members, do they eat every time the same food and same timings?
No, no, ma'am.
Then humans can't eat the same food and same timings. Okay. So first
Hmm.
of all, we can't like clock the baby that the baby should take every 2 hour or every 3 hour. It's on the
Okay.
demand. See, breast milk, the composition keeps changing. Sometimes the milk might be more dense, sometimes it would be lighter. As you would have also observed that in the morning times you would be seeing better milk supply, and by the evening the milk supply goes little down. Have you ever observed it?
Yes, ma'am.
Okay, so now when the composition will also keep changing accordingly. So maybe and also the babies are more active in the night and they are like more sleepy in the days. So what happens, because this is a very different phenomena. We can't clock. We can't eat the same timings every time. So that's why, and especially when the mothers are pumping, that time they are pumping and they are able to give the baby the bottle accordingly. But when a baby is breastfeeding, then it is always demand feeding. We never say clocked feeding, that the baby should take every 2 hour or every 3 hour. Now, as your pediatrician says that at this age, the baby should take for only 10-15 minutes and that they should keep a gap of around 3 hours. This is not done. We can't clock a baby. Sometimes the baby might feed for 10-15 minutes. Sometimes they might feed for 45 minutes. And how to know whether the baby is drinking or sleeping? That you can see whenever we are drinking any liquid, you can see the gulping movement in the neck. You have to observe during feeds, you can see the gulping movements in the baby's neck. That means the baby is drinking. If you're not seeing the gulping movements, that means the baby is sleeping on the breast. So now how you can make sure the baby is doing a proper latch and is drinking properly? So first thing is you have to have a good deep latch. If the latch is good, the baby will be able to empty the breast faster. Second thing, you have to work on your flow. So doing oil massage and warm compress will improve the flow because it will dilate the vessels and the milk flow will be good. So these two pointers you have to work upon. Now, since the baby's weight gain is fine, that means the baby is getting enough milk. But the only two issues that the baby is taking too long time and the baby is asking for frequent feeding. So what you have to do, after every feeding session, you just see the color of the milk. If the color of the milk looks thick white even after feeding the baby, that means the baby has not emptied the breast properly. In that case, just do hand express for a few minutes and that milk you keep giving the baby every feeding session. So the baby will get high milk and the baby will be sufficed for a longer time. Okay?
Okay, ma'am. Ma'am, is it okay to have bottle, to introduce bottle at this age?
You got the baby from bottle to breast. Now, why do you want to go back?
Means how to, means do you think we should go for spoon feeding when?
No, but why do you want right now your baby is on exclusive breastfeeding? Why do you want to
No,
go to
means you
on the alternative
mentioned, right?
methods?
You hand press it and empty the breast and then give
That
that.
huh? That will katori spoon. That will be not much. That will be a very small amount. You just collect it
Okay.
and give it with a spoon. That's all.
Okay. Ma'am, I feel
Okay.
that mostly she doesn't empty it completely.
Then you have to work on your flow. And after the feeding, just like hand press or you can use a pump for 5 minutes. That's all.
Okay. Thank you, ma'am.
Okay. Okay, welcome. Next question is Seema. Can we leave for 4 hours in night without expressing feeding? Now that depends, Seema. If your milk supply is good, then we don't need to express the milk regularly. But if your milk supply is low and you are working on improving the milk supply, then at least 3 hourly we should empty the breast. Chandni, I'm trying to give pumped milk to my baby, but she's rejecting the bottle. What can I do? You can use salada, you can use a nifty cup, you can use kadori spoon. These three things you can use that will also work in giving expressed milk to the baby. That's all for today. I don't see any new questions. If anybody is writing their question, just put a weight in that so that I know that you're writing the question. Seema, if I do pumping frequently, how much milk production will increase in how many days? Hey, that's a very vague question, Seema. Every mother is different, every baby is different. How can we know that exactly that much amount you will get in exactly that much amount of pumping time? No, it's not a machine, it's a human body. Every time you will get in a different amount. Maybe when you pump in the morning, you'll get more. If you get pump in the evening, you'll get less. So that will vary every day. And also, it's not only about the quantity, it's also about the composition of breast milk because this is a human body. It's not like a machine that you click 10, 10, tuck, 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 and 10 minutes give me 40 ml. It will come out. No, it will not work that way. Creating frequent demand will let your brain to make more milk, maybe the amount or maybe it will improve the composition. That is nature's work. That is not our work to decide. What we need to do, the easiest way to do is track your baby's formula intake and track your baby's weight gain. If you're tracking these two things, then you don't need to worry about your milk supply. I'll give you an example. 2 days ago I had a mother who is from outside India. She worked with me. Her when she started the treatment with me, her baby was taking formula milk around 12 times, around 120 to 150 ml. The baby was taking. She was pumping 8 times. She was getting 90 ml per day. Now, recently after third, I had a third call around 2 days back. That time her milk supply, she was pumping the same 8 times. From 90 ml, the milk supply went to 180 ml. Only 90 ml increase. But her formula milk, from 12 times, it has come down to 2 times and that to only 90 ml. And the baby's weight gain is very good. In fact, it is going more than required. Then by reducing the formula, how is the weight increasing? Because if we see quantity wise, the baby mother's milk expression is from 90 ml to only 180 ml. She's producing 180 ml per day. But from formula milk 120 to 150 ml, the baby was taking around 12 times. But now the baby is taking only 2 times. How come? How the formula reduced by increasing the weight with only 90 ml increase in the mother's milk? So please, again, that's what we were discussing. So much of like self doubts because of the quantity. Everybody's focused on running after quantity. I should make liters of milk. I should make a lot of milk. No, you have to track your baby's weight and track your formula. You don't need to create stashes of milk for that. Nature is very helpful. Even small quantity of breast milk will reduce formula a lot. And always remember, 60 ml of formula doesn't equal to 60 ml of breast milk. You all count that way. My baby takes 90 ml of formula per feed. I need to produce 90 ml per pumping. And when I get only 10 ml, I am depressed. No, please clear your doubts. It is very sad to see mothers just obsessed about the quantity. That doesn't work that way. You have to track your baby's weight and formula intake. Next question is from Roxana. If I freeze breast milk, then how can I give it to my baby? Should I warm it before giving to baby? Yes. So suppose you have kept a stash of around 120 ml, and right now you take out suppose 60 ml. So if you take out 60 ml, now how you can warm it? You just boil water in some utensil and keep this milk in either a steel container or a glass container and keep this inside the hot water. The milk will get warm due to the warmth of the hot water. And then before giving to the baby, always check the temperature of the milk. Then you can give it to your child. Sakshi, ma'am, you asked to hand express before after feeding, and it is thick. That means breast has not emptied. When it is thick milk, what if thin milk comes? That means the breast is empty. So always remember, thin milk, the watery milk means fore milk. When you start the breastfeeding session, it is always a thin watery milk comes in. That is fore milk. Now, after feeding session, after sometimes the milk becomes thick. That is hind milk. Now, if your baby has emptied the breast, first the fore milk will go, then the hind milk will go, and still if the thin watery milk is coming, because breast is never empty, so it will keep making more milk. So if you're seeing thin white milk after feeding your baby, that is the new milk which is in the process. That means your breast is empty now. But if you see the thick white milk coming, that means the baby has not emptied the breast. It is the hind milk which is still there in the breast. Okay. Chandni, I'm trying to exclusively breastfeed. If baby is fussy after breastfeeding due to less milk, can I give formula immediately? Yes, you can give. That's okay. But work on your breast milk so that you improve your milk and you don't need to depend on formula milk. Okay. So that's all for today. I don't see any new questions. I hope the answers were done and you found that a useful session. So that's all for today. We'll see you again next Friday, same 9 p.m. Bye-bye.